What I'm going to get across is the importance of trying to reduce diagnostic delay, because we know that that quicker diagnoses lead to better cancer outcomes in terms of stage and survival. So it's vital that we try to diagnose cancer more quickly. We also know there's a lot of variation between different countries in how quickly they diagnose cancer. And there's also a lot of variation in cancer survival between different countries. And putting those together, there's a good hypothesis to make that firstly, diagnosing cancer more quickly is going to be better for cancer outcomes. But secondly, the countries and the health systems where the diagnosis is slower, that is likely to be the cause of that. And the health systems can learn from each other, so that the health systems with lower with less quick diagnoses can pick up and learn from other health systems and get better cancer outcomes as a result. So that's the background to why it's important. And the bits or the sections of the process that I'm going to be talking about in my talk today are about how you can change behaviour in the population and patients about seeing their doctor, and how family doctors and primary care staff can respond to symptoms. So in terms of the population, we know that what are often called awareness campaigns, people will have seen these things, seen TV adverts and billboards that say, if you're coughing for 3 weeks, see your doctor. We know that they're effective in the short, medium term about having about changing behaviour and getting more earlier diagnosis. And the key things with those campaigns is they do two things. One, they educate about symptoms. And secondly, they actually tell people what to do in response to them. So it's not just, if you cough for 3 weeks, you should worry. It's cough for 3 weeks and go and see your doctor. So there's a combined message there which legitimises them going to seek help. So we need to do more work on understanding those campaigns and how they work and how to make those better and how to get long-term effects in terms of patients presenting symptoms quickly to primary care, because that's absolutely key. And the second thing we need to do is we need to change behaviour of GPs, and I say change behaviour of GPs, and that's in response to how they deal with symptoms. And there are several aspects to that. It's issues like how they what's called safety net, which is the process by which, if a GP isn't quite sure what's going on, which is quite a lot of the time in general practice, rather than just say, oh, I don't think it's anything to worry about, whatever, they should actually be more proactive and saying, look, I don't think there's anything to worry about, but if you get this, this, or this, I need to see you again in 2 weeks, 1 week, whatever, and then we'll do this. So it actually allows people to come back if they have got ongoing symptoms, which for cancer is often the case, because most cancer symptoms begin with something that is very common. A bit of tummy pain, a bit of not feeling quite right, a bit of a cough. They're the symptoms that we most commonly attribute to benign causes. But rarely they're due to cancer. So we need to legitimise patients coming back. So that's one aspect to it. GPs also have to be able to use decision support tools, IT, to help them identify people that are most at risk of currently having undiagnosed cancer. So understanding what the predictive value of certain symptoms added onto certain risk factors at certain ages in certain groups means, which will help guide their investigation and their referral processes. So that's about behaviour change, and then that's kind of largely in the hearts and minds of GPs to get them to think and act differently. And those changes are quite possible. We change our behaviour as GPs all the time. I'm a very different GP now to what I was when I first qualified as a GP, through ongoing change and education. And the third thing we urgently need in primary care is we need better tests. We need better investigations. We need better access to investigations, both more general investigations and more cancer-specific investigations. Whenever I talk to groups of GPs about trying to diagnose cancer better, it's often me saying, do more of this, do more of that. And they say, well, you tell me, what am I going to do now less of instead? And that's a difficult problem, which is why I say that we must begin to work smarter in different ways and harness technology, harness algorithms that can be embedded in GP computer systems that actually help us in our diagnostic processes. So we need to do more, but we need to work in smarter, different, more efficient ways as well. And that's quite a challenge.